What are the different types of kidney and bladder stones in dogs? If you are a dog owner, you may have heard about kidney and bladder stones, also known as uroliths. Understanding the types of stones that can form in dogs is essential for their health. Let's break down the different types of kidney and bladder stones you might encounter. First, we have calcium oxalate stones. These are quite common, especially in smaller dog breeds. They form when calcium combines with oxalate in the urine. This often happens due to high calcium levels in the blood or urine. And like some other stones, calcium oxalate stones are not caused by infections. They are hard and challenging to dissolve with medication, often requiring surgical removal. Next up are struvite stones. These stones are made up of magnesium, ammonium, and phosphate. They usually form due to urinary tract infections caused by bacteria that produce urease. This bacteria raises the urine pH, which encourages stone formation. Struvite stones are more common in female dogs and can sometimes be dissolved with dietary changes and antibiotics. Then we have urate stones. These stones form from uric acid and are often linked to liver disease or genetic issues that affect uric acid metabolism. Certain breeds, like Dalmatians, are more prone to these stones. Diet and metabolic factors can also play a role in their formation. Cystine stones are another type, but they are quite rare. They occur due to a genetic defect that causes excessive cystine in the urine, leading to stone formation. These stones tend to affect specific breeds and requiring specialized management. Lastly, there are compound and mixed stones. These stones consist of multiple mineral types, which can make them more complex and sometimes harder to treat. From a clinical perspective, calcium oxalate stones are the most frequently analyzed stones in canine kidneys and bladders, followed by struvite, urate, cystine, and other less common types. The formation of these stones can be influenced by factors such as diet, dehydration, urine pH abnormalities, infections, medications, and underlying diseases like liver disorders. Diagnosing the type of stone involves physical examinations, urine and blood tests, imaging techniques like X-rays and ultrasounds, and sometimes stone analysis after removal. Treatment options vary based on the stone type. For example, struvite stones may be treated with diet and medications, while calcium oxalate stones often requiring surgical intervention. Preventive measures include dietary adjustments, ensuring your dog stays well hydrated, and managing any infections or metabolic conditions. Knowing the specific type of kidney or bladder stone is essential for effective treatment and prevention in dogs.